What is up, you guys? My name is Alessandro Koenig, and today we have Dr. Robert Ziltzer, and we're going to be talking about his amazing book, Chasing Diets. So, Robert, I got to understand, what caused you to create this amazing book?
There are literally tens of thousands of diet books, and everybody wants to answer the question, what is the best diet or what's the best medication? And it really kind of misses the whole point that weight loss is a medical disease. It's a very serious medical disease, and everybody thinks that they should be treating it on their own. And really, the purpose of this book is to get the point across that if you have a medical problem like diabetes or like cancer, you don't read a book on how to treat them. You go to a medical clinician. You may go to a doctor, and the doctor says, look, for your problem, the treatment is, and these are the various components. Diabetes, for example, is very, very much like obesity. You may change your diet, you may go on a medication, you may need some emotional support. And if you go to a doctor who has an expertise in weight loss, they will give you a medication. They will treat you as if you have a medical problem. So we wrote this book to help people understand that you can't treat this on your own.
So, I remember doing research into how you created Scottsdale Weight Loss, watching one of your older videos, speaking on how your father had passed away, and that really caused you to leave primary care and build this business with Dr. Premack. Would you say that he had an effect in inspiring you to create this book?
Absolutely. I knew at a very early age that I was at risk for heart disease. And, in primary care, we treat diabetes, right, with pills. We treat high blood pressure with pills. And we're kind of ignoring the fact that for many people, overweight and obesity are the cause of high blood pressure, diabetes, many of the diseases we treat in primary care. So my father had his first heart attack at 52. He had a second heart attack at 57, and that's what he ultimately died from. And I realized that we better treat the underlying problem. And for many people, the underlying problem is obesity. So rather than just putting people on pills, I'd always said if I can help people lose 50 pounds, 100 pounds, and keep that weight off, I'm going to leave primary care. And so 2006, we treated our very first patient, and we realized, hey, we can get people off of these medications. We can reverse the effect of diabetes and high blood pressure with proper nutrition, sometimes with weight loss medications, but with the right kind of support. And I can tell you, it's a lot more fun going to work every day when people are coming in and they're feeling better as opposed to they're just having to take more pills.
That's incredible. And also, like, of course, you're aware of the fact that there's so many fad diets on social media. Would you say that that also had an effect in you creating Chasing Diets? Because the title makes sense. I mean, a lot of us are chasing diets. We're thinking that this diet might work, that diet might work, and we're listening to the wrong people. So would you say that had a big effect too as well?
Uh, our average patient has been on around a dozen diets before they come see us. And some of them may have worked for a short period of time, but none of them worked really well, and none of them led to sustained weight loss. So our goal is to help people get to their goal quickly, and then most importantly, to keep the weight off. And it's all about how much weight you've kept off in a year, not how much weight you lose in the first, second, and third month. Now, we do believe that fast weight loss is better than slower weight loss. Getting to your goal faster is better as long as you're getting complete nutrition. So we know that if you starve yourself, well, you're going to lose weight, but you're going to lose a lot of muscle. You're going to lose your hair. So we got to make sure you get all the nutrition you need. So what do you need? Well, you need protein, you need essential fatty acids, vitamins, minerals, electrolytes, water, some fiber. So as long as you give people all the nutrition they need, um, we can actually get people to lose weight very quickly because we have access to special medical nutrition, special diets. The other thing is that with all the talk of GLP-1 medications, well, GLP-1s are not the only medication. We've had medications for decades that are very, very effective. So you don't always have to go with the most expensive option, and GLP-1s are very costly. We have drugs that work right away and have been around for many, many years. Our goal is to make it easier for people. And one of my mottos is don't try harder, try easier, right? Everybody thinks that weight loss has to be hard. So, yes, people go from diet to diet to diet. They lose it, gain it, and they're on this roller coaster and they become very discouraged. And what we provide is the hope that, yes, you can lose it. You can lose it actually quite easily, and you can keep it off, but you need the right kind of treatment.
Okay. So what's the difference between, a bodybuilder that was previously obese and, they're starting to lose a lot of weight, but, they're taking diuretics to do it and not GLP-1s, and they're losing like probably around 5 pounds a week, where it's like, can be pretty unhealthy. Would you say that there's like a situation where there'd be too fast of weight loss? And how would you moderate that and make sure a client is not trying to take that bodybuilder route?
So a lot of bodybuilders, they want their muscles to look better, and they take a water pill, and that just again causes you to lose water, and that's clearly not healthy. That's not leading to fat loss. Now, bodybuilders, people that have a lot of muscle mass, they're going to lose faster, and we do have patients that can lose a pound a day with the proper type of nutrition, but we don't use diuretics. That's a dangerous way to go. But we can safely create a very large calorie deficit, and that's what really results in very fast weight loss.
So the max amount of weight you would want a client to lose is around how many pounds a week?
Well, it depends upon the person, right? So if it's a very tall young man, sometimes someone who's say 25, they're 6 feet 5, we can sometimes help them lose large amounts of weight, even a pound a day. However, if you have a postmenopausal woman who's maybe 5 feet tall, they may only lose weight, a pound a week or a pound and a half a week. So it depends upon their particular metabolism. So when someone comes in, we tell them, okay, based upon your goals and your metabolism, we would expect you will lose X number of pounds per week. So we can actually calculate that using our special body composition measures that we have.
Okay. How do you handle like the training side of things? I know, you're not using cookie cutter situations for every patient, and everybody's body type is different. So how do you handle that side?
Exercise needs to be individualized to what the patient's goals are. Do they want to gain, muscle bulk? Do they want leaner muscle? So that may determine whether they do cardio, whether they do, weight training. I can tell you that exercise is super helpful in keeping off the weight. It has lots of other benefits. It won't dramatically speed up their weight loss. And that's a common misconception is, hey, if I do enough exercise, I can lose weight just with exercise alone. And that's really rare. For example, if you want to lose 2 pounds a week through exercise alone, you'd have to run the equivalent of 90 miles a week. And that's just very
Oh my
difficult to do.
goodness.
Yeah.
Yeah, that's a lot. So if somebody approached you wanting to read this book, Chasing Diets, and they said, I want to be directed to your favorite, most valuable chapter in this book, what chapter would you direct them to and why?
I think the most important thing to understand is the physiology of obesity. There are hormones. One of them is called leptin, and leptin's role is to communicate to your body, to your brain, how much fat you have. So as you gain weight, your leptin levels go up, and leptin lowers your appetite and raises your metabolism. So as people gain weight, even though they're overeating, they'll typically hit a plateau of weight gain. They'll kind of hit their set point weight. However, when you lose weight, your leptin levels drop. That is your body's way of, it's called metabolic adaptation. That's how our body conserves fuel. So as we lose weight, our metabolism drops and our appetite goes up. And that will slow down the weight loss. So the more people understand why they're not losing weight, the more and understanding these hormones, the more it'll make sense. And it really speaks to the fact that this is a medical disease.
100%. It's definitely trial and error. And, these patients have gone through a lot. So it's phenomenal that you're so patient enough to help them out and figure out the solution. And thank you so much for coming on this podcast and answering these questions.